Happy New Year. Good morning, good morning, good morning. And welcome to the Great Lakes Health Radio program on Power 96.5 FM WUFO 1080 AM. My name is Francesca Messiah. I am the manager of workforce development for Kaleida Health. And so happy to welcome you to another year of health education, information, all types of different topics that pertain to Kaleida. And I know for the past couple of years, I've been talking about having a program talking about ortho, and I have found someone this year for ortho. Kaleida Health. You may wonder, who is Kaleida Health? Kaleida Health, we are the hospital system. We are Millard Fillmore Suburban Hospital. We are Buffalo General Medical Center, Oshai Children's Hospital. We are Gates Vascular Institute. We're also in Olean General. We have two long-term care facilities, one in Buffalo, one in Niagara Falls, New York. We also have urgent care in at DeGraff, I should say DeGraff, which is in Niagara Falls, New York, Niagara County. Um, and we are over 13,000 employers. So Kaleida Health, we are Western New York's largest healthcare system and provider of quality health for all ages. Well, today our guest is Stephanie Lolito. Good morning, Stephanie. How are you?
Good morning. Thank you, Fran, for inviting me.
Oh, you're welcome. And Stephanie is a registered nurse, also has her bachelor's in nursing, and she's a practice manager at our Hertel Elmwood Medical Clinic, or Hertel, I should say, a Hertel Elmwood Medical Center. And that's here in Buffalo, New York, on a couple of bus lines. And today with Stephanie, we are going to be discussing new primary care services at Hertel Elmwood. So Stephanie is our first half hour, and our second half hour of the program, we'll be talking about diets and foods you may want to food you may want to have, especially after you've had cancer. But that's our second half hour. Today, we're going to talk about primary care services at Hertel Elmwood Medical Center. Stephanie, tell me, why is primary care so important for adult wellness? And if you could briefly describe what happens during a wellness visit.
Certainly, Fran. Thanks. So, having a primary care doctor is really important for day-to-day living as well as, your long-term quality care for yourself. And overall physical should be completed once a year. That's on everyone. This is a comprehensive screening. It covers a head-to-toe assessment. We have screening tools. We can check for dementia, falls risk assessment. We evaluate activities of daily living that tells us how well you're able to perform for your own day-to-day care. Social determinants of health. This kind of helps us look at any barriers that you're having out in the community, adequate food, housing, transportation. We're able to provide immunizations on site based off of your age. That's appropriate. We do screening blood work and testing right here on site. We're able to draw your labs. We're able to test for diabetes at the clinic. Along with the exam, we have an on-site pharmacist, and we're able to work with any patients who have blood pressure or diabetes that isn't managed. We can help you work through strategies to make you successful in managing your condition. A social work team and a care manager to help with those barriers in the community to help prevent hospitalization. And the whole goal of primary care is to make you successful in your community and having quality care.
Thank you so much. During a well visit, Um, should the patient bring anything with them?
We recommend that you write down any of your questions or concerns ahead of time. This helps to ensure that all of your concerns get addressed during your visit. The topics can bounce from, one thing to another, and sometimes you get distracted from what you wanted to really talk to the doctor about. And so this helps to keep your appointment focused. A list of your medications are always helpful. And if you do have high blood pressure or diabetes, or you're tracking your weight or anything like that, any type of log book that you're tracking your results on is also helpful to share with the provider. But other than that, we just need you to show up for your appointments.
Thank you. So, and also, I know you just mentioned having patients write things down, and I've said more than once on the program over the years, please write things down in advance. So, if you're watching, I don't know, you're watching Law and Order, you're watching the news, all of a sudden you're noticing an ache or pain. Write it down in a place that you'll remember to bring it to your wellness visit with you. And something I always say, and Stephanie, I'm sure she would agree with me, um, ask if you're nervous, ask someone at least a week or two in advance if they can come with you, because we want the patient relax, right? Stephanie, is as relaxed as they can be.
Absolutely, Fran. So having another set of eyes and ears is always just helpful. Sometimes I think that when you're discussing a lot of healthcare concerns, some things get lost in translation. Somebody may become overwhelmed, only heard part of it. And so having a friend with you, or somebody that keeps you calm or helps keep you focused, or can write down things for you while you're trying to be attentively listening to a provider, is certainly helpful for the patient to recall what happened during that visit, especially if they have a lot going on.
Yes, and also sometimes you want someone to tell the truth. Like, I know sometimes you might want to go. I know. I want to ask you, can a child go in with their mom or dad or grandparent, or can the husband or wife go into that appointment with them?
Yeah, so you can bring, anybody with you, and as long as you are consenting to having them in the room during a provider discussion, then absolutely you can bring them with you.
Yes. Oh, thank you. Over the past 10 years, and I'm thinking about technology, have primary care services changed? And if yes, how have they changed?
Well, yeah, certainly technology has definitely helped primary care grow in the way that we get results, in the way that we're able to provide the care. With the electronic health record, every year they're making, upgrades, and things keep changing with the way we're able to obtain the patient's information. And what we can see, even if the patients are, going outside of the Kaleida Health system, we have access to being able to pull those records for easy accessibility and better care.
Hmm.
Results for blood work and imaging results are able to flow right into a patient's chart, and they give a notification to the provider. So this allows for prompt provider notification of the results. So there's faster reaction, right? If something's abnormal, you're not waiting for some facts to come through and somebody to sort through the facts and then for it to get in a bin, right? So it's
Right.
automatically there for somebody to review, and there isn't a delay like there used to be for when those results come in and when you can start getting treatment or care for something that might be abnormal. One of the things is that I think that the patient's portal is a great access. The patients are able to see their own results right away, or send a message to the office without waiting on hold or trying to make a phone call. And you can text while you're at work, or when after hours at night when you're thinking of those questions, like you were saying. If you're watching TV and you come up with a question, or you need your med refills and it's 9 o'clock at night, you could send us that message and we would get it the next day. So that's also a great option.
So, do you mean that you can type your questions into the patient portal?
Yeah.
Oh, I didn't know that. Thank you.
Oh, yes, you could send the office a message and we would receive it the next day. And yeah, we have staff assigned to go through those messages and make sure they get routed and providers are able to tend to those.
And how does one get connected to the patient portal?
When you are assigned to us as a patient, or actually, even if you go to any Kaleida facility, um, they can register you for the portal and get you linked.
Oh, that's wonderful. In case you're not comfortable doing it yourself.
Yes, and so if somebody can help you, there is a number you can call. Most of the staff, we have ways that we can assist you with getting that registered on your phone. We do that for patients all the time, assist them on their cell phones, helping them load it. Or we can also do it. Our exam rooms have those exam screens, with educational material and things, but we have a tile that you can click on and able to fill out the information needed and get the portal set up for you right in the exam room while you're waiting for the provider.
Oh, that's excellent. Speaking of which, I kind of touched on it, but where is the Hertel Elmwood Medical Center located? And when we talk about this topic, about the Hertel Elmwood Medical Center, is there an age limit where you can start where you are able to see the visit, or is it for the entire family?
Yeah. So we are an adult site, which means we take age 19 and older.
Okay.
Yeah. We're located at 900 Hertel Ave right here in Buffalo. It's close to, the two major intersections of Hertel and Elmwood, or Hertel and Buffalo, or Hertel and Delaware. And we are along the bus route 23, where the stop is right at the end of our driveway, which makes that very convenient. We do have an open parking lot that's free parking. So we do have a lot of great, easy access to our clinic.
Speaking of easy, can more than one family member see the same physician?
Absolutely. We encourage the whole family to make sure that they have a primary care doctor. We do have several patients that, that they're related to each other and they schedule their appointments at the same time. And this is to make things easier on them, such as transportation, days off of work. For example, if you're the person taking care of your elderly patient and you're the caregiver, you've already had to take off of work this day, we would want to make sure that you get the care you need as well on that same day, alleviating any extra barriers that may come in the way of you taking care of you, because obviously you need to be in great care too.
Mm-hmm. And I don't want to confuse people. Yes, you let's say four members of your family can all see the same physician, but they would not see you at the same time, correct?
That is correct. You would get four separate appointments. Now, you could pick the same provider and we call them back to back appointments, right? Because everything has to be individualized, and you would want that provider to take the care for you and make sure that they're evaluating your needs. And so, yes, if you came with somebody else, you would expect to be here. If your each appointment is roughly, a half hour long, then the first person is going to get their half hour. The second person is going to get their half hour.
Mm, thank you. If someone is diagnosed with diabetes or heart disease or cancer, um, can diagnosis like that be made at the Hertel Elmwood Medical Center, or do you have diabetes education or heart disease education? How does that work?
Yes, Fran, as primary care, we're able to treat and manage many different diagnoses right here on site. We do have several specialists in our building that also offer care here. We have a cardiology, plastics, podiatry, as well as the pharmacy who work with diabetic and hypertensive patients. But if a patient needs a specialist outside of what we can offer, we are part of the whole Kaleida Health system and have access to great specialists. So we're able to make that referral and assist them in getting an appointment. We do have a referral manager, is what we call it. She assists in getting any authorizations or referrals and helping patients get appointments so that they can go ahead and continue that care that they may need. And us being able to have a great access to the whole Kaleida Health system, this allows for open communication when you're using all one system and all of your records flow seamlessly.
Wow, that's great. So you don't have to go somewhere else for your diabetes education. And do you have diabetes education right there on the premise? I just want to make sure our listeners understand that.
Yeah, so we do have a pharmacist here that if you have diabetes, we have a pharmacist that can work with you on medications. We do not have a dietitian on site. Kaleida Health has a dietitian if you need. We can do some basic food modifications and tracking. But if you need a full nutritionist, we would recommend, referring you out to a special dietitian for that. Kaleida has endocrine, but as far as getting everybody started, yes, we have basic education for diabetes, heart disease, well care, all the things to start your care. And then if it's elevated that it needs a higher level of care, we can then, hook you up with a specialist. But we do provide on-site education.
I know you've had and can you talk about some of the cancer education programs that you've offered at Hertel Elmwood?
We don't have any oncology or cancer right here on site, but we are part of, Cancer Cares or part of the network that can offer you or get you linked with services for that.
Okay. And I asked the question because I thought one point in time you had a program at Hertel Elmwood talking about smoking cessation. So it wasn't, I mean, so it was part of our cancer care um, umbrella, but I thought a year or so ago you had something to talk to smokers.
So we do smoking cessation as
Okay.
well as screening. So if a patient has smoked for, so many years, they're as of a certain age, there is appropriate testing that should be done as far as a lung screening test. And we do all of that as far as ordering that, screening for that. But once somebody is actually diagnosed with cancer, then they would go for a specialist for that type of treatment and what those options are. But we certainly do screening tests for multiple varieties of cancer. As far as prostate, we draw the labs for that. There's screening for the lung cancer. So you are correct that we would do screening testing.
And I should say that, yes, because screening listeners, and you've heard me talk about this all the time, and matter of fact, screening, so that Hertel Elmwood, you that's great that you do screenings because it's all about catching it early if you have it, in the screenings. Well, Stephanie, something that really got us interested and got me interested in interviewing you today. And I thought when we talk about the past 10 years, our city, our region, Western New York has changed so much. And one thing you were talking about were the languages. And I was fascinated with all the languages. Could you elaborate on that, all the languages that if you walk into the Hertel Elmwood Medical Center, that one will feel comfortable with?
Absolutely. We are very lucky to be a part of a resident teaching program here at Hertel. And with this, we have a very diverse provider group. So currently in our program, we have providers who speak 14 different languages. We have Spanish, Arabic, Bangladesh, Tamil, Punjabi, Chinese, French, Dutch, Japanese, Nepali, Hindi, Persian, Russian, and Urdu. So quite a variety there. And along with the providers who speak many different languages, we also have access to a video interpreter system that allows for a larger array of languages and dialect options that we can utilize. We do use this almost daily, and it's really great for patients to be able to come into the clinic and be able to express themselves and feel like they are heard. It really helps to open up the communication and getting linked and connected with your provider. And something else that's super important is we are also linked with companies for the hearing impaired. So it's just
Yes.
wonderful to have these services available to really communicate with the patients and to make sure that they are getting the best care that they can get.
Yeah. Now, what if somebody wanted to write a question in the patient portal? Can they write a question in their native language in the patient portal?
That is a good question. So that actually has not happened to us yet. If they did do that, I do have access to that same video interpreter service. I could utilize any of our services to have it translated. So if that did happen, yes, we could make that work.
Mm-hmm. And you know what? Stephanie, if someone's listening and they needed primary care, who would they call? How would they get in contact with you or the medical assistant at the Hertel Elmwood Medical Center?
Yeah, so our primary line here is 716-871-1571. And we are open 8:30 to 4 every day with the phones, Monday through Friday.
Mm-hmm. And you close at 4 o'clock. So the last patient visit would be 4 o'clock.
Yes, we're in the office till 5, but yes, the less scheduled patient is then.
Mm-hmm. Okay. What are some of the things you would like listeners to know, that questions I haven't asked you today?
I was just going to mention that we do also have early appointments. So while the phones go on at 8:30, we do have 7:30 appointment time slots for the patients. So that does allow for those people who need to try and get in before work to hopefully help with those, or people who work the night shift and want to try to get in quickly before they, go to bed for the day. And then one other thing that we didn't really touch on that I wanted to talk about was we do also utilize telehealth or video visits, which also is convenient, especially if you are really sick and you can't make it out, or you can't get the day off of work, but you need to see your provider for a specific reason. Those are great for a one type problem to review. Obviously, a physical needs to be face to face because it's great for convenience, but a face to face appointment provides the most comprehensive care. But I just wanted to say that, the clinic is growing and growing here. And we are now an offsite for Kaleida Health for echocardiograms being done on site. And we're adding more and more to the clinic so that once you become a patient at the clinic, we try to offer you as much as we can here so that you're not running all over town to try and get everything done. We want to draw your labs here. We want to do, your blood work, your EKG, and have your specialist here. And so that when you come, the staff, your providers, and you're feeling comfortable in the same environment every time.
And Stephanie, something that's really key that I never thought of that you just mentioned, if you're not feeling well or you have a question or something and you have that privacy and your job, you could possibly, with telemedicine, telehealth, that person could make an appointment while working and never have to leave their office, correct?
Yes, that's right, Fran. Yeah, it's a great convenience. Again, it's for a specific problem. You're not going to do your annual physical where we're doing your annual assessment, but we do phone visits all the time where, respiratory season is here and you're not feeling well. You have a sinus infection, or, you've had a belly ache, or, urinary tract infection. You want to go over some of these things with a provider, or maybe we've changed your blood pressure medication and the doctor, wants to know what your blood pressure is. You could do a phone visit to follow up on that instead of having to come in every single time.
And I know we have the Visiting Nursing Association. However, it may not be necessary for the visiting nurses to come out to, let's say, your elderly loved one, your aunt, your mom, your dad, your grandparent. You could probably, and tell me if I'm wrong, make an appointment, call from their home. And then that way, if they're not feeling well, they can, maybe you can have your appointment before either the visiting nursing comes out or before they go visit you at Hertel Elmwood Medical Center. Is that another type of a way of utilizing telemedicine, telehealth?
Yeah, Fran. So we definitely partner with the VNA, and we have a lot of patients who utilize the home care service, and we are connected with them. So they have ways to call us directly while the visiting nursing is there. And so, right, if they see a patient's blood pressure, a wound change, a patient's status declining in the home, they can call us and say, "This is what I'm seeing." And we're able to make adjustments with somebody else's eyes, depending on what it is, of course, uh,
Mhm.
which could eliminate, yes, somebody having to come in, especially when it's difficult for them.
Yes, yes, yeah. That's great. Well, Stephanie, I know we're almost out of time, so your closing comments.
I would just like to say for 2025, for the new year, for everybody to make it a goal to get a primary care if you don't have one. We are available for you. We are accepting new patients. Again, our phone number is 716-871-1571, and we hope to see you in the new year.
Yes, and I also want to add that I know if you go to the Kaleida Health website, KaleidHealth.org, and if you type in there's gonna be a little, the little our little glass, little eye, and if you type in Hertel Elmwood Medical Center, you'll see a lot of what we're discussing today in terms of the different specialty providers that are right there on the site at Hertel Elmwood Medical Center. So everything that we're talking about today, if you go to our website, I know our web team is and Stephanie, working along with Stephanie, who is a practice manager. I know they have all that information as up to date as possible, along with the phone number. One more time, Steph.
716-871-1571.
Thank you. Thank you so much. And I just want to thank you for being our guest today, this morning, our first guest of the 2025 new year on the Great Lakes Health Medical Program. And I just want to tell our listeners, hold on, don't hang up, don't change the dial, because our next topic we're going to be talking about is eating healthy choices post cancer treatment. Again, we're going to be talking about healthy eating choices post cancer treatment. That's our next guest on today. Again, Stephanie, thank you so much. Our topic practice, your title is practice manager at the Hertel Elmwood Medical Center. And now on to part two. And welcome back to the Great Lakes Health Radio program. If you're just tuning in, this is a second part of our interview. And if you missed the first interview, which began at 7, from 7 to 7:30, our topic was primary care. Getting a primary care physician for yourself, your family members, your loved ones at Kaleida Health, Hertel Elmwood Medical Center, where they are taking new patients. And if you'd like to hear that interview, you can Google Kaleida Health, Kaleida, Great Lakes Health Radio Program. It'll bring you right to the program. Or you can also YouTube Great Lakes Health Radio Program. Well, our guest for today is Kelly Cardamone. Good morning, Kelly. How are you?
Good morning. I'm doing great, Francesca. Thank you for having me.
Oh, yes. And Kelly is not a stranger by any chance to the program. And today's topic, we'll be discussing healthy eating after cancer treatments, which was a flyer that came across my screen here at Kalida a few weeks ago. And I said, really? I said, who's discussing that? And I saw Kelly. And I know Kelly has been on several times to discuss all aspects of health and diet and different disorders. And Kelly, before I ask the first question, I'm going to ask you, how did you get involved in nutrition? Just real briefly. What got you started?
I was my background was in exercise phys, so my first degree, and so that was my early 20s. And I think that really is what sparked nutrition. And I just started realizing that I cannot, to recommend exercise and physical activity and all that, I was missing that key component of nutrition because the two of them go hand in hand. And we'll even talk about that today. How important those two go together. And I just started doing more reading on my own and then just sparked my interest in nutrition.
Yeah. Oh, okay. And the reason I ask, I was at an event recently and somebody asked me if I ever talked about cardiac and nutrition. And I said, of course. Do you know Kelly Cardamone? And this person said, of course. So we're on the right track. But anyway, back to today's topic, which is healthy eating after cancer treatments. And again, having patients who are in remission, is this a new topic? Is this new for patients who are going through chemo about eating and nutrition? Is this a new area, healthy choices post-cancer treatment, or has this always been around, or is this something new?
So, a great question. It really has always been around. I think what we're seeing now is this movement, right? And I'm going to step back and just say heart disease, number one killer in the United States, right? Leading cause of death. Cancer is second in that. So we're looking at something that is pretty prevalent and common, but we've had this big movement is in food as medicine. And I've been a dietitian for about 20 years, and it's been wonderful to see this embracing by not just people in general or patients and clients or the population, but also we've seen that providers and healthcare providers, and they're embracing the importance that nutrition has on our health. And so with regards to cancer, the cancer society, the American Cancer Society actually has nutrition and exercise as part of their guidelines. And they have been out for quite some time. So I think it's just everybody is collaborating and you got that multidisciplinary approach. And I think
Mhm.
that's really what it is. And I will say patients are asking for it. Do you know what I mean? I think
Great.
that's a big part of it too.
Oh, good. And the best thing that you said is that people are now collaborating because you can't do anything alone.
Right.
You
Right.
you need collaboration. And what are some of the myths and misinformation about nutrition following cancer treatments?
So, for everyone listening, I want to remind that I think we all acknowledge and understand, and everybody knows someone, family, friend, or yourself who has been, touched or impacted by cancer. It is, I think, one of those diagnoses that when people are diagnosed and then they want to prevent a reoccurrence, or even if you're trying prevention of a reoccurrence, or even during treatment, I don't like to use the word desperation loosely, but you are in a sense desperate. You feel like it's out of your control sometimes. And what can you do? Right. So unfortunately, everybody kind of searches the internet. They ask their friends and family members, and there is so much misinformation out there. A lot of the questions we get asked really revolves around soy products. That's a big one. Are
Mhm.
there foods that are bad for you? Do I need to eat organic? Are there supplements that I can take that will prevent? And if you Google search any of those, you will find some sort of regimen book. And unfortunately, as I've said in previous interviews, and this goes for any chronic disease out there or anything you're dealing with, you really do have to look at the research and you have to look at what we call a risk benefit ratio. If it's eating more blueberries, I'm just throwing out an example. That's not
Right.
going to hurt you, right? There is, I mean, unless you're, don't eat, 15 pounds a day. But if you're trying to introduce more fruits and vegetables, okay, that's, something that's not going to be high risk. But when we get into certain supplements and stuff that are not regulated, that's where you have to really be cautious. And a lot of the stuff out there is anecdotal. So, yeah, that's a lot of what we deal with. And even when I did the lecture a few weeks ago, that was the same thing. It's like I heard this and I heard that. And so, as dietitians, we have to stay on top of the research that's out there. Any professional does.
And when you say anecdotal, what does that mean? What do you mean by that?
It is so there's nothing proven. I might say I think this, there might be even like I have a theory, but there's nothing behind it. That we don't really have good substantial research. I mean, even for instance, if there was a research study on 10 people, that is not something that as a professional I would transform the way I practice for 10
Mhm.
people, because that's not what we call generalizable, meaning does that represent the whole population? So anecdotal just basically means we think it might work, but where's the stuff to back it up? Where's the science?
And I know you're an expert in the area, and you're with I didn't even tell it, so your title. Your title is a general visit. You work for general physicians, which is a part of Colida, and you're the clinical nutrition and diabetes program manager.
Mhm.
But my question is oh my gosh, I'm sorry.
That's okay.
I just forgot my I just forgot my own question, but I now it just came back to me. Where else would someone know? So if someone is listening and they're in Wisconsin, do most practices where you're going for your post cancer treatment have someone there to talk about nutrition? Let's say if they're nowhere near Western New York.
Yeah, another great question. And here's the thing. Unfortunately, so this has been, I think, seen as an issue across the country, meaning that a lot of cancer treatment centers, organizations, that we now know, right? Like the guidelines say nutrition and exercise is really important during treatment, but also post treatment, right? And it is individualized. And so now we need the experts, we need the dietitians. The unfortunate part I will share with you is insurance doesn't always cover it. So it's not like diabetes, chronic kidney disease, that's covered. When we get into things like oncology and cancer treatment, it really is specific to the insurance company. And if they don't have what we call a comorbidity, if there's no diabetes on top of it and someone has Medicare, how can I see the dietitian? What we're seeing now is a lot of these organizations are basically they're hiring their own dietitians.
Mhm.
And I know Great Lakes Cancer Care just did that recently as well. I know myself, I was a big advocate for that as other dietitians and professionals. It was like, you need to just hire somebody. Don't worry about billing. So kind of push that aside because
Mhm.
we need that person there to support your patients. And that's what you'll see is that a lot of these centers hire dietitians, they don't bill, and they really allow all patients to have access to them. And that's the best way, really, to make sure that everything, that everybody has access.
Yeah, and I just have to say, when people say we have a cure, you should take this. I'm going on personal experience when my
Yeah.
sister had cancer, and I remember like, how do you know who are some of these people? So please don't if someone says they have a cure, they have a this or they have a that, question it and try and and look for a dietitian. Ask wherever you are having your cancer treatment,
Yeah.
just see if they have it. But that's all I wanted to say on that. So if you could please share some of the simple changes, some of the changes of food that persons who have had cancer, who are currently going through treatment, what are some of the things that they can do to their diet, and or if that family member or a loved one is cooking for them, what should they lean more towards? What should they avoid? Like if they're used to having spicy food all the time, how does that affect, I know that I've heard that chemo or different treatments sometimes give you sores in your mouth. It sounds like a spicy food, you want to eliminate that. But what other foods?
And so and I will share, that's where it becomes a little bit more individualized because it has to do with every cancer treatment is different. You know what I mean? Some will cause you to have nausea. Some of you, some will cause taste changes. some may cause sores in the mouth. So it really is individualized, but you are correct. Things like acidic foods, spicy foods, just like if you had, in a sense, like a canker sore in your mouth, you would try to avoid those things. But during treatment, it's really, and that's why it's important to work with a dietitian. And a lot of times, even wherever you're getting treatment at, they'll have handouts for you to kind of talk about, nausea and appetite and the importance of protein and things like that. With regards to, preventing like reoccurrence, because that's the common thing I get is how do I prevent a reoccurrence? And, I will share that the risk of a reoccurrence or secondary cancer, it depends on a lot of factors, right? Type of cancer, age of diagnosis, and all those things. Research, really shows that the one big thing that can help prevent reoccurrence, believe it or not, that has good potential is exercise. So exercise is really important. And anything I'm going to mention right now is directly from the American Cancer Society guidelines. So for anyone listening out there and you're like, okay, where do I get my good information from? I don't have access to a dietitian right now and I'm Google searching. Go to the American Cancer Society. And that is just, you can go there, and that is cancer.org. You can also, if you're looking for other organizations, is the American Institute for Cancer Research, which is ICR.org. That's another great resource. So now I want to get into like some of those guidelines. You're asking, what should you do? 1, exercise. 2, you want to maintain a healthy weight. That is huge, like really for prevention during treatment. And believe it or not, post-treatment. So now for survivorship, we know that weight gain in adult life increases risk of certain cancers. The other thing is it's healthy eating. And what I'm going to say right here is, I think, nothing that you have not heard before. Why I state that is, it's nothing like totally out of the box or crazy, right? It's the typical, you want foods that are high in nutrients, meaning fruits, vegetables. I say eat your rainbow every day, a variety of fruits and vegetables. The coloring that's in the fruits and vegetables, believe it or not, is where they get their specific benefits, right? So eat your reds and your yellows and your greens. Same thing with fruits, whole grains. Choose whole wheat products, whole grain products. You want to avoid the white stuff. You want to avoid the processed foods, the pastries, the candy, the junk food. And it's really limiting red and processed meats. So red meat and processed meats like lunch meats. You want to try to avoid those sugar sweetened beverages. And really, again, those highly processed foods. And I will also state it is limit alcohol. And depending on the cancer, they might recommend abstaining or not drinking alcohol at all. So that is very specific as well. But I'm sure you can see that those are not, it's a healthy way of eating. And that's the biggest part. The one thing I tell clients or when I'm doing a lecture is the biggest thing is do less processed foods and really, focus on your lean proteins, the tuna, the Greek yogurts, good stuff, but get those fruits and vegetables in. I push that for every chronic illness or disease, fruits and vegetables.
and you also press it for just in general.
Yes.
General.
For everybody.
I have a question. It's just a little step, what is, and I only because I ran into someone recently in the community who you are working with. They are a cancer survivor. And they said ever since they spoke with you or they met with you, because I commented how they looked really good, looked like they lost some weight. And they said, Kelly said to exercise every day, like 30 minutes, something. Why is exercise and cancer treatment, why do they go hand in hand?
So one of the biggest things is, and I'll be honest, I probably have to dive a little bit more into the research to tell you the specifics, meaning
right.
What does it do on a cellular level? But the bottom line is, for a lot of individuals, it does help with blood flow, cardiovascular. As I shared, I'm sure there are things that it does on a hormonal and cellular level, but also what it does is for a lot of people, it helps them to maintain a healthy body weight as well. And that's longevity. So that's a part of it. We really kind of push, people think that necessarily when they go through cancer treatment that, you see that someone might lose their hair and they lose a lot of weight. That's not necessarily true. For some treatments, you'll see patients that have gained weight.
True.
And we really want to focus on survivorship. Let's eat healthy. Let's get ourselves moving, and let's try to get ourselves to a healthy body weight. And that's where that exercise comes in.
Yeah, and I guess I even look at the title of the show. We even could have said healthy eating after survivorship. Instead of cancer treatment. What are some of the frequently asked questions that you hear about eating from patients that you have worked with or currently working with?
The big one, believe it or not, is soy. And I will share that, probably 5-10 years ago, it was thought if I have breast cancer, I should not eat soy products. Soy products cause cancer. And even if you go to the two websites that I talked about, American Cancer Society and the Institute for Cancer Research, we know that that's not true. If you actually look at cultures where they have a diet rich in soy products, it actually can reduce the risk of overall cancers by about 36%. The interesting part with that is that when I'm talking about soy products, it's not like supplements, like powders. It's eating things like edamame, tofu, tempeh, that those foods, like whole foods, don't increase estrogen in the body. Another one is like phytoestrogens. It used to be thought, no phytoestrogens. And flaxseed is very high in phytoestrogens, but it actually can be preventative for breast cancer. So that's one of the big ones. The other one is organics. Do I need to eat organic? And, I share with patients that organic has not been proven, meaning if you avoid or eat, non-organic, does it cause cancer? There really is no research to back it up. I share with patients, one, it can be more expensive. So it's not in your budget. It's okay. The bottom line is, sure, if you can swing it financially, go for it. But if not, you just want to increase your fruits and vegetables. I don't care if it's not organic. You know what I mean? Like, it's just the importance of getting those in your diet. The other thing is sugar. And you'll see a lot of like, sugar causes cancer. I have cancer. I can't eat sugar. It feeds the cancer. It is way more complex than that, is how I'm going to put it. I won't get into, there's like insulin-like growth factor. And the bottom line is, if you're going through treatment and you had, a holiday cookie or a dessert or a treat, that's not necessarily feeding cancer, if that makes sense. That was another kind of fallacy. And it was misinterpreted, is how I'll call it. The other one, sorry, the last one I would say, and there's many, artificial sweeteners. People ask, do those cause cancer? I will share, like, the ones that are out there commonly used, like the sucralose, Splenda, equals stevia. The research does not support that they are cancer causing. Again, moderation. If you're going to have something a little bit in your coffee, tea, drinks, that's okay. You don't want to drink everything you have diet beverages or foods. You want to make sure you're staying hydrated and drinking plenty of water, especially during cancer treatment, right? You want to flush and keep yourself hydrated, but especially, also post treatment. But those are some of the most common that I'll hear.
How about French fries or chicken? Our favorite, French fries, chicken wings, chicken wing dip.
So we know that those high fat diets, like, if you look now at the top cancers, we've got lung and prostate, colorectal. We now know you're seeing younger people with colorectal cancers. Part of it is the American diet. That standard American diet, that SAD diet, is very high in processed fast foods. One, the increased calorie, there's a couple things. The high fat can change the microbiome. It's really not great overall for gut health, but it also increases caloric consumption. So you're more likely to kind of gain weight, right? And we know it increases risk of heart disease. So overall, just not good to have. Once in a while is okay, Francesca. Once in a while, you can have your French fries and your chicken wings.
Once in a while. And sometimes you might have to bring your own food to something. I remember years ago, I would watch people bring their own food to luncheons and, different things. And I thought, oh my God, who in the world would ever bring their own food, especially when we talk about some of these high caloric diets and such. But now I have to say, I've raised my hand. I am one of those people who, even to a football party, will bring a salad if I know they are not going to have anything green or anything healthy. So, don't let people shame you if you know that you feel better eating something. Just bring your own if you know it's not going to be there, because you know how you feel, and you're the one who can control that. So don't let people try and make you feel bad because you want to feel better while you're in remission. um h- are you taking new patients?
We are, yes. My team is, and I also, if you don't mind, I just want to throw out to, all dietitians really. Um, so it's a specialty, right? I kind of give the example of like if someone's a general practitioner, but you have specialties for endocrinology and GI, and dietitians in general really can guide you on the basics with regards to nutrition during prevention, during treatment, and after. However, you really want to try to gravitate towards someone who really does have experience, as I just shared, like what's the research, answering your questions. And I will share that because I've focused my energy on other certifications and schooling. But there are dietitians out in the community that actually have a board certification. And so if you see out there, it's the CSO. They'll have that after their name. That's a certified specialist in oncology. It doesn't mean you can't see a dietitian that doesn't have that, but those dietitians will have 2,000 hours of practice hours working in oncology, and they will have passed a board certification. So I'm just throwing that out there for anybody listening. It's just something to keep in mind, looking for those credentials as well if you want something a little more specialized. But my team is definitely taking patients. We see a lot needing of oncology and do stuff in the community.
And how would they reach you?
So the best way to reach we have an admin assistant, and her name is Christy. She's fabulous. So if you call her, it's 716-748-4000. So 716-748-4000. And that's a direct line right to our admin.
Oh, thank you. And what are some other things you would like to share with us about healthy eating after cancer treat? How soon after? So let's say someone just got, their results, everything came back. They just have to because I don't know the exact I don't know the sequence of when someone is diagnosed to what happens to when they're cancer free. I don't know the sequence. So at what point would someone come see you? Would they come and see you like make an appointment before surgery, maybe after surgery? At what point would they come to see you?
And any point in time. Really what it is that I tell everybody, we are here to support patients. And it's an overwhelming for a lot of individuals. It's an overwhelming diagnosis. My mom was diagnosed in the spring, or excuse me, this past fall, and it was, very overwhelming. And and my point is, there's so many things you're trying to navigate. It's when you feel you are ready, because sometimes you have so many doctor's appointments and you're like, oh my goodness. And we're here for you. It's really when you're ready. For some individuals, when they are done with cancer treatments and they're more into that, post-treatment, and if they're cancer free or that survivorship, I think that's when they've been able to step back and breathe for a moment. You know what I mean? And really kind of then focus on moving forward. Because sometimes during treatment, there's a lot going on. But we are there for you. And again, as you said, wherever you're getting treatment or you're in college, just ask, is there resources here? But yeah, we are here for you, because it does change. Someone during treatment and then nutrition or pre-surgery to then survivorship. The nutrition, when I say, can change because during treatment or pre-surgery, we might be focusing on other nutritional concerns.
And trust me, I've worked with Kelly for many years. She's been a guest on our show. So if you are, can't if you're a survivor, and your glucose, not glucose, sorry, dairy, you can't have, you're unable to have dairy, or you're unable to have bread products. Kelly will work with you, so that's what she talks about, the individual treatments. So if you're dairy tolerance or gluten, she will work with you for what you can eat. So it is not trying to make everyone fit. It's never about trying to make everybody fit um into a cookie cutter, into one mold. Yeah. So just write down your concerns. Can people bring someone with them, and so they can listen to, like, when they go to see you? Is there room for another body to listen
Yeah.
to?
Yes, we encourage that for any of the visits, even if someone's coming for other things like diabetes, weight management. We always encourage support is better. Another set of ears, especially with cancer. Again, any kind of diagnosis, and you're like, oh my goodness, that extra set of ears. I went with my mom to all of her appointments because that extra set of ears is kind of like, okay, I heard this. I have questions always. And if you don't mind, I'm just going to throw in one last thing and a side note. If you are going through treatment, survivorship, and you are on supplements, because most individuals are taking supplements, there was research that was done that showed most patients don't necessarily think of disclosing to their doctor that they're on supplements. Any supplements that you are on during treatment or post, make sure to talk to your oncologist about, because sometimes they're contraindicated with treatment. So I just want to throw that out there. Be mindful, even bring them with you to your appointments to show
Yes.
somebody. Okay.
Yeah. Well, Kelly, we have about a minute left. Anything else you'd like to share with us?
Honestly, if you're sitting there going, how, looking for resources, I will just say the one movement we're starting to see now, just overall for diabetes, for kidney health, and even oncology, really is kind of doing more of a plant-based eating pattern. There are plenty of websites online. I love Forks Over Knives. They have vegan, but even if you go to, there's websites like Skinny Taste, and you can do vegetarian, but that plant-based eating pattern, we're seeing a lot of traction and movement, and it really does have its place in oncology as well. And it's, again, eat more fruits and vegetables, whole grains, eat a potato over eating bread, that
Yes.
eating that less processed foods. Other than that, just take a breath, and really know that there's a lot of resources and people out there to support you.
And also, what I'm seeing more and more popping up are people who are who are making meals for
Yeah.
post cancer. Also, just make sure they're certified. What is their background? You just want to double check with people. And if you have a nutritionist such as Kelly, you can also check with Kelly. But on that note, Kelly, I want to thank you again for being our guest. It will not be the last time that we hear from you in 2025, but I want to thank you for being our guest on the Great Lakes Health Radio program. And next week, you will hear from my esteemed colleague, Cindy Bass from ECMC. And on the fourth Saturday, beginning at 7 a.m., you'll hear from me, Francesca Messiah, Manager Workforce Development. Take care. Thank you for supporting our program and listening to us. Stay healthy. Be healthy. Bye-bye.